Assalamu alaikum everyone. Today we will get information about the first cranial nerves function, that's olfactory system. First of all, look at that. And first of all, we should provide information about receiving the impulses from the nasal cavity, okay? In fact, the first neuron of the olfactory system is propeller neurons, and according to its name, it has two polars, two arms, okay? And the first arm is located in the nasal cavity under the mucosa, nasal mucosa, okay? And look at that, that's nasal cavity, and it's covered with nasal mucosa, and under the nasal mucosa, the first polars of the bipolar neurons located. Their main function is accepting dissolved some kind of other molecules from the mucous membrane, okay? And after receiving this kind of other molecules, they generate action potential and send information to the second neurons located in the bulbus olfactorius. If you talk about the nasal cavity, I should say that the nasal mucosa contain not only mucosa, but it involves immunoglobulins A and E. Okay, their main function is fighting against some kind of viruses or bacteria. Okay, and the impulses from the bipolar neurons sent to second neurons, and second neurons located in the bulbus olfactorius, and the bulbus olfactorius send the information in the two ways. First way is lateral olfactory striae directed to the lateral part in the ipsilaterally, that's right side of the hemisphere, and lateral olfactory striae sends information to the lateral part of the hemispheres, and the medial olfactory striae, but this striae sends the information contralaterally to the left side, from the right side to the left side, okay? And look at the, first of all, we should talk about lateral olfactory striae. Its first destination is this part of the hemisphere. This part is the medial part of the temporal lobe of the hemispheres, okay? And this part consists of uncus and amygdaloid body. And according to this destination, the impulses received by this part of the hemispheres, and the main function of the uncus is some kind of recting of the human body according to the type of the odor, pleasant or unpleasant, okay? And the emotion is created by uncus due to the type of the odor. The second function is creating new memories due to the type of the odor. And you will consume some kind of meal or smell some kind of meal, and this meal can be saved in your memory, and this memory is generated by uncus. And the amygdaloid body's main function is storing this memory in your hemispheres, okay? That's the main point, don't forget that. And the next destination is, after stopping there, the impulses continues to the entorhinal area. Entorhinal area is one part of the Brodmann area, and their main function is also for memory, storing the type of the feelings due to the smell of some kind of objects or meals, okay? And that's lateral striae. And let's talk about the medial striae. The medial striae, as I mentioned above, cross the hemisphere to the contralateral part, and their first destination is subcallosal area. Subcallosal area is the bottom part of the corpus callosum, and their main function is suppress amygdala. Look at that. And the fibers that exit from this part of the hemispheres from the subcellular area direct to the amygdala. Look at that. It's a long way and connect with the amygdala. Its main function is regulating the olfactory system by suppressing the amygdala. If this pathway, it's my opinion, if this pathway is not exist, and the amygdala will be overactivated. Okay, by this fiber, the lateral olfactory striae suppress the medial olfactory striae's function. That's regulatory pathway. Okay, and the next destination is some kind of synapses in the subcallosal area direct to another part of the cerebrum. Okay, and the first destination is habenular nucleus. Habenular nucleus, the main function is connect the forebrain and midbrain. Okay, and in fact the habenular nucleus is the part of the thalamus. Okay, and the habenular nucleus, the main function is increasing the dopamine. I have some kind of ideas about the main function of and main importance of this structure in olfactory system is, you know, the dopamine is can increase your mood, and by this way, according to the type of the smell, might be your mood will increase. Okay, and the next destination is tegmental nucleus. After synapses with tegmental nucleus, there is another neuron initiate its direction to via dorsal longitudinal fasciculus. Please look at that. That's important. Dorsal fasciculus nucleus, the main function is accepting information from the hypothalamus and carrying to the parasympathetic or autonomic nucleuses that's located in the pons and medulla. Okay, let's talk about the cranial nerves that's located in the pons and medulla. If you know the anatomy of the neurology well, you will get information. You know the information about the glossopharynx and vagus, and the main function of the glossopharynx is innervating the sweat gland. Innervating the salivary glands that's located in your hand, submandibular or something like that, and its main function is stimulating them and increasing the secretion. Okay, and the next nerve is nervus vagus. Nervus vagus' main function is innervating the whole part of the gastrointestinal system, and its main function is increasing the motility and secretion. By this way, according to the smell of the food or another kind of object, the organism might be ready to digest them by increasing salivary, by increasing some kind of salivary glands, and some kind of gastrointestinal secretion will increase, and the human body will be ready to digest some kind of foods. Okay, and the next structure is reticular formation. You know the reticular formation, so many function in human organism in the autonomic nervous system and sympathetic and parasympathetic for regulating the breathing or heart rate and something like that. According to the type of the odor or smell, the reticular formation will increase its function or decrease, and according to this, it can adjust the human body due to the type of the smell. And our next information is about the clinical part of the olfactory system. As a neuropathologist, we can deal with some kind of patients who are suffering from this normal function of the olfactory system. First one is anosmia. Anosmia means that there is no any smelling. Okay, as a patient couldn't feel any kind of smell. It might be due to the loss of propeller neurons, second neuron, some kind of lesions and the tractus. I should say that when the patient gets the trauma, this part is susceptible to breakdown, and as a result, this breaking can impinge on the conducting the impulses from the bipolar neurons to the secondary neurons. Okay. Next symptom is hypothemia. Hypothemia means that the decreasing the level of sensing some kind of olfactory stimulus. Okay, the patient can say that I have some kind of difficulty in the analyzing the acuity of the smell or odor. Okay, the next symptom is hyperosmia. Maybe it's rarely in clinical considerations, but it may happen. In this symptom hyperosmia, the level of the degree of accepting the odor stimulus will increase. Okay, and the next symptom is dysosmia. Look at there, and in these symptoms, the patient says that when I receive some kind of odor from some kind of flowers, I feel some kind of smell of the meal. There is the smell, but it is not the real smell. It's another one. That's dysosmia. And then next, the last symptom is olfactory hallucinations. The difference between dysosmia and olfactory hallucinations is in the dysosmia, there is the smell exists, but the patient feels another one. But in olfactory hallucinations, there's not any smell, but the patient provides information about I'm smelling something pleasant or unpleasant, and something like that. And all of the information is all for you today. Thanks for listening and watching. And if you have some kind of suggestions for us and some kind of greetings, of course, we are always ready to accept in the comment side of our YouTube channel. And I guess and I believe that this kind of video lessons will be beneficial for your future career. Thanks for listening and watching one more time. Take care of yourself.